Hello once again, it's your favorite Eko Pharmacist, and you're welcome to this week's episode of your favorite show, your favorite program, Chronicles of an Eko Pharmacist. I'm sure you enjoyed our previous video. Please, I would appreciate if you can drop your comments, questions, and reviews in the comment section below. Today we're going to be talking about another popular drug, which we all know as paracetamol. Yes, paracetamol. Simple, right? It's something you use almost every time. Yes, but it's not so simple. Paracetamol is also popularly known as acetaminophen. For those of us that are international people, if you go to areas like North America, the United States, and the likes, you would popularly hear it being called acetaminophen compared to paracetamol that is quite popular in this part of the world. And paracetamol is actually an antipyretic and an antipyretic and a pain reliever. What do I mean by an antipyretic? That is to say, paracetamol is used in the treatment of fever and pain. So when you think of pain, the first drug you should think of is paracetamol. Paracetamol is actually highly more tolerable, in people compared to aspirin and other non-steroidal anti-inflammatory drugs. How does paracetamol work? Paracetamol works by inhibiting COX-3. Yes, I'm sure you would remember from my previous video, I mentioned COX-1 and COX-2. Now, there is also COX-3, which is a split variant of COX-1. So, paracetamol inhibits COX-3 enzymes, which invariably inhibits the production of prostaglandin, but not thromboxane, because it doesn't inhibit COX-2. So COX-2 is responsible for the synthesis of thromboxane. You understand? While COX-1 is responsible for the synthesis of prostaglandin. So paracetamol inhibits COX-3, which is a split variant of COX-1, thereby inhibiting prostaglandin, which is responsible for the feel of both fever and pain. Now, the inhibition of prostaglandin invariably inhibits prostaglandin stimulation on the nociceptive neurons, that is the neurons responsible for the feeling of pain, as well as the hypothalamus, which is responsible for the feeling of fever. Invariably, paracetamol prevents pain and fever. Yeah, it makes sense now. Now, how do we use paracetamol? Yes, the dosing of paracetamol. This is very important because I've seen quite a number of people and patients, even close relatives, abuse paracetamol. You hear people say, 2 tablets of paracetamol doesn't work for me, so I decide to use 4. 2 tablets of paracetamol doesn't work, I decide to use 5. There is actually a proper dosing for every drug on existence, or every drug in existence has a proper dosing. And adherence to this proper dosing is actually key to maximizing the therapeutic effect of these drugs. Now, what is the actual right dosing for paracetamol? Now, generally, paracetamol in patients that are less than 50 kg, in body mass should be given 500 milligram at most 4 times daily. 500 milligram 4 times daily. Now, for most paracetamol tablets in this part of the world, they come in formulations of 500 milligram. So, invariably, for patients that are less than 50 kg in body weight, they should be using just 1 tablet. Just 1 tablet. But of course, we have paracetamol tablets or caplets that are also produced, to a dose of 1 gram or 1000 milligram. So in that case, you probably would have to not use that for patients that require 500 milligram. So for patients that are 50 kg, that are below 50 kg, which most times are kids and frail and fragile elderlies, you use 500 milligram for a maximum of 4 times. That is 4 times daily, max 500 milligram. But for patients that are, have a higher body weight, we use a dose of 1000 milligram for a maximum period of 4 times daily, with a spacing of at least 4 to 6 hours. So invariably what I mean is this: if you take 2 tablets of paracetamol now, you are not supposed to take another 2 tablets in the next 1, 2, 3 hours. You should take another tablet in at least 4 hours time. That is the minimum amount of time that should be in between your first dose and your second dose. And you should not exceed using it for a maximum of 4 times daily, which equates to 4 grams daily. Now, in children, we dose drugs according to body weight. But of course, there is a relative range of weight expected in an healthy child within a particular age range. So I will be explaining this dosing in children relative to age. Now, for children between 3 months to about 1 year, we require paracetamol dose of 60 to 125 milligram for at least a maximum of 4 times daily. Now, most paracetamol liquids preparation, that is your paracetamol suspension or syrup, comes in a dosing of about 100 milligram in 5 mils. So 5 mil prescription for a child of 3 months to 1 year is relatively the standard prescription, for a maximum of 4 times daily. For children higher than 1 year to about 5 years, we give a dose of about 125 to 250 milligram. That's about 10 mils on an average in your paracetamol syrup. And for children from above 5 years old to about 12 years old, we give a dose of 250 milligram to 500 milligram. One thing I would love to discourage in this video is this. Please, parents and caregivers, let us avoid breaking paracetamol tablets for our children. Rather, let's get the syrup if a lower dose of lesser than 500 milligram is required for the child. Breaking the dose doesn't ascertain a proper dose for your child. That being said, let's address the issue of our Brother Shegun and Brother Kunle that goes to site to work for 2K daily and comes back to actually take 4 tablets, 5 tablets. I've even seen somebody take 6 tablets of paracetamol at a go, all in the name of 2 tablets doesn't work for me. Let me take 4. Let me take 5. It works better. But then, what happens when you do this? There's what we call hepatocnecrosis. Hepatocnecrosis simply means the death of your liver cells. I know you'll be like, wow, liver? What does liver have to do with paracetamol? Let me shock you. Your liver metabolizes almost every single drug you use. That is to say, there's hardly any drug you take that doesn't go through your liver to be broken down into metabolites that are either excreted or used in the body. Now, what happens in the case of paracetamol? When you take paracetamol, it dissolves your gastrointestinal tract, gets absorbed into the blood, goes into the liver, and gets metabolized by 2 processes. One is sulfation, and the other one is glucuronidation. Now, these 2 processes break down your paracetamol into a form that is non-toxic, and they get excreted in your urine. However, about 5% of the paracetamol that goes into your liver does not get metabolized by these 2 processes. However, they get metabolized by something we call a cytochrome. Cytochrome are enzymes in your liver. And the particular cytochrome that breaks down this 5% of paracetamol is known as cytochrome P450. Yes, it's so much English, but just note it is cytochrome P450. And what happens when cytochrome P450 acts on paracetamol is this. It converts the paracetamol into a toxic metabolite known as N-acetyl parabenzoquinoneimine. Yeah, big English. But for short, it's known as NAPQI. 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 You could remember it better using napkin, but then it's known as NAPQI. Now, NAPQI is a toxic metabolite, you understand, that results from the metabolism of paracetamol by cytochrome P450. But then, nature is awesome. It has provided us with an antioxidant in the liver that also, inactivates this metabolite into a non-toxic form. This antioxidant is known as glutathione. I know that rings a bell. It is trending now. Every drug now promises it contains glutathione. So glutathione, inactivates this NAPQI into a non-toxic metabolite and is excreted in the urine again. So what happens when you use excess paracetamol? That means excess NAPQI is produced. And note that there are limited amount of glutathione in the liver. So when you have so much NAPQI produced and less glutathione to, inactivate this NAPQI, the NAPQI accumulates in your liver and begins to kill your liver cells, leading to death of liver cells, which can finally lead to liver failure, and then before you know it, you're already at the other side of the river. Basically, what I'm saying is this: say no to overdose of paracetamol. Adhere strictly to the required and prescribed dose of paracetamol that is given to you. If paracetamol seems not to work, speak to your pharmacist. There are other alternative drugs with higher efficacy than paracetamol that can handle your level of pain. Those drugs will be addressed in our subsequent episodes. Please don't forget to drop your comments in the comment section. Drop your questions in the comment section, and they will be addressed on this show. Thank you for staying with us. Stay tuned, and God bless.